Health officials are on high alert tonight after the first case of Ebola was diagnosed in the U.S. The man who traveled to the United States from Liberia is now in isolation in a Dallas hospital, said to be in serious condition.
Now the Minnesota Department of Health and Mayo Clinic are responding to that confirmed case and what it means for us here in Minnesota. ABC 6 News reporter Steph Kroc reports.
A nation on high alert after learning the deadly Ebola virus has made its way here from across the globe.
In some ways, it was a matter of time before we saw a case, especially since the outbreak in West Africa continues to rage on.
Though Mayo officials say they anticipated this, they say they don't see it traveling far.
We are not going to be seeing community outbreaks of Ebola like they are seeing in West Africa. And this is related to our public health infrastructure, which is robust, as well as our access to medical care.
We will control this importation or this case of Ebola so that it does not spread widely in this country.
The Minnesota Department of Health also released reassurance Wednesday, saying our public health system is well prepared.
All hospitals need to be prepared to identify Ebola patients quickly, make sure they get the right treatment, but also put them in isolation.
But this Ebola victim was on U.S. soil for a week before being diagnosed. Still, officials say it's unlikely others will get sick.
They are not contagious, even if they're sort of in that incubation period. And they're really only contagious when they are sick.
Really, the only instance where officials fear another American contracting the disease is if they travel to West Africa, like that victim.
And I'd be very concerned about somebody who is traveling to any of the affected West African countries.
In Rochester, Steph Kroc, ABC 6 News.
Well, individuals who may have had close contact with this patient have been identified, and they are being closely monitored right now. And doctors say the patient is isolated but will not be sent to a hospital with a special biocontamination unit like others are brought when they come to the U.S. for treatment.